The party nominated Shailaja, who has been lauded for her handling of the COVID-19 and Nipah outbreaks in Kerala, as the CPI-MS chief whip in the next assembly. Why is she dropped out of the new cabinet of Pinarayi Vijayan? Kerala has a healthy medical system, which was founded by the early Christian missionaries of Kerala, and it was strictly followed and built it up by the different state governments of Kerala. With a robust public health system, the state of Kerala is taking the lead in India's response to COVID-19. The Indian state of Kerala is celebrated for its efficient response to COVID-19. Built on decades of investment in rural health, education, decentralized administrative systems, and a huge network of women's groups, Kerala has created a healthcare model that prioritizes empathy and responsiveness. This strong social and administrative fabric has made Kerala a prime example of how other states and countries could respond to the pandemic. In uncertain times, health systems must build the trust and confidence of patients through conscious efforts of the health workforce. One of the reasons that the COVID-19 healthcare model in Kerala has proven effective is because it is based on empathy. A motivated healthcare workforce is at the core of the Kerala model. Dedicated medical professionals such as doctors, nurses provide their entire time in looking after the patients. Again, the caste of the patient is irrelevant in Kerala. Kerala has the maximum number of registered nurses in India, and they can be found all over the world. According to the Indian Nursing Council, of the 20 lakh registered nurses in India, 18 lakh are from Kerala. Historically, intrepid nurses from Kerala traveled to remote corners of the country and the world, a trend that continues today. A WHO report noted that nurses trained in India form a significant portion of internationally educated nurses working overseas, second to nurses trained in the Philippines. It is estimated that over 30% of nurses who studied in Kerala work in the UK or the US, with 15% in Australia and 12% in the Middle East. A significant number work in other parts of India, with Delhi, Bengaluru and Mumbai being among their favored cities. In the 1970s, we could see that the nurses and nuns of Kerala are mainly missionaries. There was a missionary nun in Trivandrum. She had come to India in 1906, along with a group of nurse nuns from Switzerland, to work in the Trivandrum General Hospital, which was patronized by the Travancore royal family at the time. The nuns took in young girls mostly from Christian families, living around the area, and trained them as helpers. The idea of service was inculcated in them as part of their religion. It is also because of the then prevalent caste system which was not permitted girls to work publicly, particularly in nursing. It was only in 1934 that nursing was formally recognized as a profession. Perhaps because of these roots, for a long time, the emphasis for nursing as a profession was on service rather than service conditions. Over the years, the nursing community grew. While it still was not a well-paying profession, it did provide these women opportunities to travel and see the world, and the assurance that they would always find employment. The beginning was difficult, to be sure. There was the stigma attached to nursing because the idea of young women handling male patients was not socially acceptable in India. Then there was the caste system, then the uniform, which attracted the wrong kind of attention. The profession was considered lowly in India. However, the wrong notion was changed by the missionaries of Kerala. Nurses from Kerala are now fighting the coronavirus pandemic in various countries, not only across India. In the UK, Middle East, USA, Australia etc. all over the world they have been at the forefront of the COVID-19 battle. Former British MP Anna Soubry observed in an interview that some of the best nurses that we learn from actually are from South India, from Kerala in particular. Therefore Pinarayi Vijayan knows the fact that anyone could be the captain of Kerala Health Ministry. For medical professionals from Kerala, it's all in a day's work. Hats off to Kerala nurses and other medical professionals.